Once I learned the impact of oral structure and function on our overall health and how impactful a role like a pediatric dentist can have on shaping that, that's what pushed me to incorporate function into our overall pediatric dental practice.
So without having a supportive, functional dentist, pediatric dentist, and some of these other collaborative partners, I couldn't do what I do.
Without my dentists, chiropractors, things like that, we don't see the same sort of progress.
Now that we know the most common red flags associated with muscle dysfunction and underdevelopment of the jaws, we have a great opportunity to intervene early and screen all of the children that come into our practice. I think traditionally what we know or what we think about in terms of poor oral health or oral hygiene and cavities is that it's very much so related to our brushing and flossing habits and some of our dietary habits. However, what we know when we look at the functional oral health standpoint is that cavity production can really result from other functional disorders going on in our oral facial region. The biggest one, in my opinion, is mouth breathing. So when we're looking at why a person or a child is getting cavities, I think we need to look way beyond, are they brushing their teeth twice a day and doing some flossing, but really, primarily, what's their breathing like? And especially if they're mouth breathing at night, then we're really drying everything out. In my opinion, I think the big genetic piece is possibly the tongue tie piece that was not treated, that then led to this phenotype of structure. So when you come to our practice for the first time, we really want to give you a baseline knowledge of what functional pediatric dentistry is. We also want to meet you and your family where you are in the process. If this is a first ever dental visit, we want to give you the nuts and bolts of keeping our teeth healthy and clean, also going over what healthy sleep looks like, what nasal hygiene is and how important it is, the importance of mouth breathing, and give you good instruction to take home with you so that you can keep up these practices at home to keep your child healthy. We are going to broaden what we do here and talk about breathing, sleep, eating, and speech, and just functional health as well. So being a mother myself, I know that each child is very different. So our goal as a practice is to not make your child and your family fit in our chair or in our box. It's to meet you where you are. And then as a pediatric dentist, I think of myself as a big child. So I really try to get down on their level and make them feel comfortable as if I'm more of a friend than a doctor that they're going to see. What I wanted to do was take every pet peeve that I have as a mom and eliminate it from this practice. We don't make decisions for parents. We partner with them, we educate them, and we find out together what the best option is for their family and their child. What we really want to do is treat each individual family as who they are and get to know them way beyond their dental need. We have different sedation options, and when we notice that a child maybe is not super comfortable in the chair or they're a little bit fidgety and we know that they need something a little more invasive done, whether it be a filling or a crown or a tongue tie release procedure, we do want to make sure that they are comfortable during the procedure and that we can be successful in getting the procedure done. So we do offer a wide variety, and how we decide is based on the individual patient and how they're doing in the chair. Yes, we talk about function and airway and breathing, but we are all foundational board-certified pediatric dentists, and that is really where our training came from. And so that is still a really big part of our practice and what we do. We just have this add-on that we now know links so well to pediatric dentistry.